Hi, Miss Lana. It's nice to talk to you today. My name is Ellie from Hopes and Seams.
And I'm Izzy from Hopes and Seams and Handmade Happiness.
My twin sister and I started Hopes and Seams, and our little sister created a handmade happiness to help spread hope through our community. And we wanted to ask you some questions during, as a nurse during this pandemic. Thank you for talking with us.
Oh, you're most welcome.
Sorry. How long have you been a nurse?
So I used to work in an urgent care setting for about a decade. And 5 years ago, I went into a hospital setting as initially as an emergency room nurse, full time. And now for the past year and a half, I've been in the operating room full time, but I'm still PRN, meaning as needed in the emergency department. So I pick up at least a shift or two in the emergency department a month.
Okay. What kind of patients do you see? Describe your unit.
So now since I'm officially like an operating room nurse full time, I have been rerouted during the COVID season because we had canceled elective surgeries up until recently. So I became a hospital resource nurse for the past couple of months. And the hospital resource nurse pretty much has to attend every code that gets called in the hospital, every code blue, any code. We have to respond to all of them. And we pretty much help every unit that needs help. Nurses will call my phone and ask me if they have a difficult IV stick, if, they don't know how to put in a feeding tube and they need help with it. Wound care, they'll call me and I will help them with that. So primarily I've been in the ER and the ICU and the COVID unit throughout the past, couple months as resource nurse.
Okay.
So that's what I've been up to.
Do you have any recommendations for the general public at this time? That's June, and we're in phase 1 in Northern Virginia.
Yeah. So as with every, bacteria, virus, and whatever, like the number one prevention of spread is hand hygiene. So, carrying hand sanitizer around, washing your hands frequently. That's the number one way of preventing the spread of anything communicable. So that's my number one recommendation. With COVID, initially they said it was a droplet issue, meaning if somebody were to sneeze, cough, the droplets are, that may spread onto others or, surfaces are what's contagious. But then they said it was airborne as well, because if it's aerosolized, it could, stay in the air for about up to 3 hours. 30 minutes to 3 hours. So then they recommended wearing masks in public. So I do recommend wearing masks if you're going to be in close proximity to others. Like if you're going to be, within less than 6 feet from others, a grocery store, anything that's tight, any store actually, because you definitely get close to people as you're walking through aisles and whatnot. So definitely hand hygiene, wearing masks when you're in very populated areas, and covering, even if you have a mask on, the sides are kind of open, so if you have to sneeze or cough, still use your elbow. If you are sick, disinfecting surfaces frequently. Those are probably the top 3 things that I would recommend.
Okay. And then how important is it to still stay safe at home as much as possible and to social distance and wear a mask?
Okay, I'll speak to staying at home. If you live with somebody who is, elderly or immunocompromised, for their sake, I would stay at home as much as you can. Only go out for very necessary items. But if, generally speaking, you've got a healthy young family, I think it's safe to go out and do what you have to do. But, like I said, hand hygiene, wear your mask if you're going to be in close proximity to others. So we're about to, I think on Friday, if our case numbers are, decent and our fatality numbers are decent, I think we're going to enter phase 2. So we definitely need to, ease our way back into society. Like, I also don't think it is good to stay trapped in a house for so long, because you're not being microdosed with the common viruses and bacteria in the air. And you need that too, to build immunity. So, as far as staying at home, like I said, if you're living with grandma who's very ill, then you want to decrease the risk of spreading it to her, because unfortunately, from my personal experience and statistically, the geriatric population is the one that doesn't really handle this well. Yeah, so social distancing. Yeah, just maintaining that personal space. I think that's important. Like, actually, yesterday, we went to the grocery store, my son and I, and we had our masks on, and there was this one lady who was coughing. She had a mask on, of course, but like I said, the side of the mask is still like loose and open, so droplets can go out from the side and whatnot. So if I was right next to her and I was somebody who was immunocompromised, and I could potentially get sick. Granted, it was probably an allergy cough. It is allergy season too, which freaks everyone out, because this couldn't have come at a worse time. It's like during allergy season, people don't know if I'm sneezing and coughing because I have COVID or if it's allergy season. So to maintain that space, at least like 6 feet, is important if you're an immunocompromised person.
Yeah.
Okay. And in your professional opinion, how long do you think the DC Metro will be needing to wear masks?
Okay, so this one's a toughie, because flu season can start as early as December. And then it lasts until usually about like May. I mean, I've had patients come up positive in August for the flu. So it can linger, it can trickle. Honestly, I think that this might be a slight issue for potentially at least 9 more months, to be honest. As far as wearing masks, I mean, I would say maybe another 6 months or so. They say this flu season's going to be, the flu season is already a season with a high, fatality rate. And they say that this one could be the worst because of the COVID coinciding with it. So I would say, I mean, it could be another 6 to 9 months at minimum, maybe up to a year. I don't know.
So really,
it is.
I know. I trust me, as one who works in an operating room and has to wear a mask, 12 hours a day when I go to work, I'm over wearing masks. And now in the public, it's like, ugh. I want to be done with it more than anybody else.
Yeah. Okay. And then who is the most vulnerable? Is it still the elderly, you think, or?
I do think the elderly are most vulnerable as far as morbidity, like they are. But as far as people like getting COVID, from my experience, yes, the elderly, like nursing home patients, a lot of them have been coming from there. We have had the Latino population has been pretty high up there with getting cases. They're young, if they're young, they're healthy, they thrive, that's fine. But like I said, the elderly population. Back to the Latino population, I always ask my patients, I'm like, well, what were you doing? Were you not social distancing? Do you wear masks in public? Like, what's going on? And a lot of them, work like I do and get exposed at their jobs. Laborers, they're still working and get exposed, and some of them do not wear masks, and hand hygiene, depending on what they do for a living, is not something that they practice as much, when you're in construction or whatnot. Yeah. So, and then living in multifamily homes have been a big culprit too. So I think vulnerable to, or the ones who I've seen, get COVID have been, like I said, the majority have been like the elderly or a lot of the Latino population. but then the ones who don't thrive from it have been the elderly.
Mm-hmm.
And fortunately, we have not had one pediatric fatality in Virginia under the age of 20 so far. So that's good.
Yeah.
Mm-hmm. Yeah.
What are your top concerns as Northern Virginia moves into phase 1 and eventually into phase 2?
So phase 1, so now we are in phase 1 and you're allowed up to like, 10 people in a group at a time. And so going to phase 2 is a pretty big jump. It goes from 10 people to 50.
Oh, wow.
So yeah, so that's a pretty big jump. My concern there would just be, obviously if you're in a room with 50 other people, you won't be able to be as distanced from everybody. That would be my concern, that if all it takes is one person out of that 50 to be sick, and then there you go, the spread it's easy to spread. And then I think phase 2, they will be opening up, I think, some restaurants, maybe gyms at maybe 20 or 30% capacity. I forget, something along those lines. I would only be concerned, like with the gym, you're running, you're doing things that may make you breathe, heavier and onto the equipment. I think as long as they disinfect, everything should be okay. Like after every use, you're on a treadmill, you're done, disinfect it.
Mm-hmm.
So I think that'll be fine. But like I said, my only concern would be that, it's a pretty good jump from 10 to 50 people. So, and like I said, all it takes is just one person, and then it can spread like wildfire, even though, like I said, it's generally the elderly that don't handle it well.
Mm-hmm. Yeah. And then what do you think are the most challenging aspects of meeting patients' needs?
So I would say, like on our COVID unit, something I would hope to see change in the hospital setting. For privacy reasons, a lot of the doors are like, all wooden, and there's like no glass. So you really can't see inside. And on our COVID unit, we close all the doors. The patient rooms, we close all their doors. So we can't really see what's going on inside. We have a call bell and they speak with us through it and whatnot, because we try to minimize our exposure to them as well. But like, it would be nice to be able to walk by and see if somebody fell out of bed, or if somebody, something was wrong, like they were having difficulty breathing, and they couldn't get to the call bell or something. So it's been challenging that the door has been closed on our patients, and that you can't really look inside and see what's going on 24/7. But obviously we don't put those kind of patients in the ones who are very high risk, like we would put them in a room where it's visible. But those are the younger, healthier ones who are having, some trouble with their airway. The ICU rooms are all glass, so we see everything. But I think that's been challenging, that the doors are all wooden and you can't see what's going on. And that's probably the biggest challenge I've come across.
Mm-hmm.
I mean, the fear, and initially, the nurses were, when this all started, the nurses were afraid, like, we have kids at home we don't want to spread this to. We have, our parents that we don't want to spread this to. And so the fear of going in and performing patient care was really real in the very beginning, until we got comfortable with it. And then the fear of not knowing if we had enough PPE, reusing our N95 masks, things like that was a challenge in the beginning. But fortunately, at the hospital I work at, we've been really good with our PPE. We have been reusing N95 masks, but other than that, head to toe, we have been good with like shields, shoe covers, gowns. Everything else has been good. So I would say the PPE and the door are probably the most challenging.
Is there anything you want to add that helps us understand how to best per, best best prepare ourselves and to keep us all safe?
Yeah, just back to like the first question, what I recommended, to stay safe was hand hygiene. Number one thing, hand hygiene. Keep a nice safe space distance between you and other people, and wear a mask when you're going to heavy populated areas. If you're going to a playground by yourself, I don't think you need to wear a mask, but I think those three things should help. And like I said, if you're sick, stay at home. Any kind of symptom, whether you think it's COVID or not, if you're sick, you have nausea, vomiting, diarrhea, a cough, a fever, anything like that, then stay at home for at least 2 weeks, just so you don't spread anything you may potentially have to others. And then disinfect the counters, anything that you may touch, doorknobs, door handles, so that your family members don't get whatever you may have.
Yeah. Well, I think those are all the questions. Thank you so much, Miss Lana, for answering them.
Oh, you're most welcome.
Have a safe and have a great day. Thank you so much.
Thank you. And congratulations, you legacy graduate, you.